Peripheral neuropathy is a problem that some people experience while undergoing chemotherapy. What we mean by peripheral neuropathy is a sense of either uncomfortableness with pressure when one walks or one touches something, actual burning sensation, tingling or pins and needle sensation to one's hands and one's feet. Now, some of the chemotherapy agents are well known for possibly causing this. In addition, people are at higher risk for this happening if they have other underlying disorders, such as diabetes, which we know puts people at risk for developing peripheral neuropathy. There are certain autoimmune diseases that will do this. Any compromise of the blood circulation, peripheral artery disease, for example, can put you at risk for this, and certain medications. So if one is already having these conditions or taking these medicines, then you are exposed to a certain chemotherapy agent which might cause peripheral neuropathy, then you have to be very, very careful. Now, peripheral neuropathy may happen very quickly when one receives chemotherapy, or it may not happen until one has received many cycles. It's very, very variable as to how this will happen and the degree of it. Typically, when one starts to experience this, the questions will be, how long, how severe is it? Can you walk okay? Can you use a pen or pencil okay? How long does this last? It might be that if it's rapidly progressing, that your oncologist will either discontinue the chemotherapy that they think is causing this or change the dose. Certain chemotherapies will make people very, very sensitive to certain temperatures. If you know that cold will bring on or cause more sensitivity, then one needs to wear gloves, one needs to make certain that one has shoes and socks that will protect you. Now, over time, these symptoms may go away, these problems may go away, but one has to be very careful about what one does, and it can be very effective in decreasing the sense of numbness and tingling. In addition, there has been some look at some of what are called the alternative therapies for treatment of peripheral neuropathy. For example, either use of acupuncture, massage, tai chi. Before you undergo these particular treatments, though, if you're receiving chemotherapy, be sure you check with your oncologist, with your clinic, to make certain that there's no problem with undergoing these activities.